We're now being joined by Dr. Ifedayo Adeyifa. He's the Director General, Nigeria Center for Disease Control. Thank you so much for joining us. Good to see you. You were part of that report there, and quite a number of issues came up at that event. But one thing that needs to be underscored, it's a vaccine treatable, disease. Why is this upsurge? Why is Kano so bad? And what's the issue with access to vaccines? Is that what the problem is?
Well, thank you very much for having me. Let me first correct an impression from the report. The NCDC is not planning to set up a national diphtheria laboratory. We already have capacity for reference diphtheria laboratory service at our reference laboratory campus in Gadua, Abuja. Thank you. So the question about vaccination in Kano and indeed elsewhere, because Kano, yes, is the epicenter of the ongoing outbreak. And I think that's just because the outbreak started there first. So they've had the outbreak for much longer than all the other states. But when we look at how quickly cases are ramping up in Yobe and in other states that have started more recently, and also have the same challenges with vaccination coverage, they have the potential to overtake Kano or be like Kano if current efforts to make vaccines available are not successful. This is a vaccine preventable disease, as you've highlighted. And the challenge with vaccination is that a vaccine in a vial is not useful until it goes in your arm, and it's not useful after it goes in your arm if it does not induce what we call a protective immune response or protective immunity against the target condition. So because of a number of factors, most of it historical, there has been challenges with vaccine confidence in places like Kano and other parts of the country, which have impeded or prevented populations from accepting vaccination or even making use of the opportunities that they have had in the past to have their children vaccinated. And this is reflecting in the age group that is most affected by the ongoing outbreak. So for the 5 to 14-year-olds, the problem they had with not getting vaccination did not occur in the last 1 year. They occurred 5 to 14 years ago, okay, when they were infants and they missed the opportunity of being vaccinated in their first year of life. And as you know better than me, or just as well as I do, we did have a historical challenge with vaccination, with even almost complete refusal of vaccines in many parts of the country due to misunderstandings that were connected to polio eradication efforts. But we also had some security challenges that cut off people and communities from access to healthcare or essential healthcare services back then. And unfortunately, for every group of children you born in 1 year, what we call a birth cohort, if you do not fully vaccinate them or you do not vaccinate sort of 80 to 90% of them, what happens is over time, that 10% that remain unvaccinated continue to contribute to a growing pool of susceptible persons. And once that pool reaches a critical size and other conditions are necessary, are met, such as introduction of the pathogen.
Dr. Adeyifa, just let me come in here quickly. Many thanks for expatiating on this. We don't have the time. Quickly here, I'm looking at the Pfizer vaccine problem, specifically in Kano, which has caused the vaccine hesitancy and distrust in the people around that area. How much of it is the Nigerian government and your department doing to sensitize the people and allay fears of these people who were once beaten?
Mm-hmm.
Let me correct you. The Pfizer issue was not a vaccine issue. If you remember, that was an antibiotic treatment trial I think for meningitis. As you know, there have been efforts, both historical and current, to address the challenge of vaccine hesitancy or to improve vaccine confidence in Kano. And our colleagues, my co-chair of the task force who heads MPHCD, can speak more to it. But you know that for example, the Northern group of traditional rulers for vaccination was set up specifically to engage both traditional and religious institutions to facilitate vaccination. The government's revitalizing of primary health care to ensure delivery of good quality essential services, including immunization, is an ongoing effort that is meant to also address some of the challenges here. There have been numerous engagement of prominent people in society or prominent influencers by both state, national government actors and partners, all in a bid to ramp up, to increase confidence in vaccines. And this continues to be an ongoing effort, which is not, sadly, it's not unique to us, because if you remember the story about the measles, mumps, and rubella vaccine and the Wakefield controversy, it took many years for the UK and other parts of the Western world to get their measles vaccine coverage back to where they were before the vaccine crisis challenge started. So we'll keep pushing at this problem.
Place for us to leave it. We'll keep pushing. We'll be on this. Many thanks, Dr. Adeyifa.